welcome back to the Sexual Health Alliance interview series. I am Dr. Eli Sheff, and I am here today with Dr. Sharon Flicker, who researches compersion. Dr. Flicker, could you tell us a little bit about where you're working right now?
Sure. So I am a professor of clinical psychology at California State University in Sacramento. Yeah, where I teach and do research and mentor students and other fun stuff.
And how did you get started studying compersion? Not only why did you choose to study it, but why did you choose to study it?
Well, so if I understand the question correctly, as I mentioned, I'm a clinical psychologist. My specialty has been, in the area of family therapy, and also intimate relationships over the 20-something years I've been doing this. And I was actually teaching a course maybe 3-4 years ago, Psychology of Relationships, and there was nothing in the textbook about consensually non-monogamous relationships. And so one of my students, who was a really great student, took the initiative and asked if she could research this and give a presentation just for volunteer in the class. And what we found was that there wasn't much research out there to draw on to give this presentation. And so that's kind of how I started doing research in consensual non-monogamy more broadly. I mean, so compersion, the concept of compersion is essentially a positive emotion that someone feels about their partner's relationship with another partner, whatever that relationship might be: love, intimate, sexual, what have you. And it's a fascinating concept because, number one, individuals in monogamous relationships, this is a really foreign concept for them. So when I tell monogamous folks, what research I do, I can see them struggling to wrap their brains around this idea. Exactly. And then also there seems to be a lot of tension even among consensually non-monogamous folks about the experience of compersion, in terms of, some pressure to experience it, and sometimes some shame over not being able to experience it, or not experiencing it, I should say. So it was a really fascinating topic for me with very little research out there. So we decided, my colleague and I, Dr. Michelle Vaughn, who's at Wright State, decided that we were going to dive into creating a scale for compersion. It's very difficult to study something quantitatively if you don't have a scale to measure it. And since I'm primarily a quantitative researcher, we decided to develop the scale.
That's fantastic. And can you tell me a little bit about that scale? Like, where is it in its stage of development? And
yeah, sure. So what we've done so far is kind of dove into the literature. So Jillian Derry has a book about compersion and jealousy. So I kind of read everything I could get my hands on, which was like this much, about compersion. And so we felt like we needed a little bit more information to go on in terms of people's lived experience of compersion. So we started with a qualitative study, went on to the polyamory subreddit to recruit individuals to answer some open-ended questions. So in the end, we had about 44 individuals who were willing to participate in the study. And we asked them questions like, what does compersion feel like to you? What does it look like in your relationships? What factors make you more likely to experience compersion, and what makes you less likely to experience compersion? And so based on the first two responses, we did what's called a thematic analysis. So we looked for patterns of responses, places where people's responses overlapped with each other, to create different items, so potential items for this scale of compersion. We sent those items out. We came up with almost 100 actually. So a lot of items. Not all of them are going to make them into the scale. We got some feedback from experts in the area, from community members, people who are part of the consensually non-monogamous community. And then we collected data from over 600 people. in consensually non-monogamous relationships in order to do a reliability and validity analysis. So that's kind of where we are right now. We just completed collecting that data. We have, I don't know, like 660 completed data responses from participants. And so we're in the process of analyzing the data to create a scale, which will hopefully be much, much shorter than 100 items.
So your participants answered a 100-item questionnaire, and then how do you decide which of those make it or which of those were meaningful enough by the way they answered them?
Yeah, so this is kind of getting into some complicated statistics that probably aren't that interesting to most people.
Right.
But what was, we had them complete the 100 items, but they also completed several other scales. So some scales that we hypothesized would be somewhat close, would be positively correlated with that scale, such as empathy, empathy for your partner, maybe emotional contagion, the ability to pick up emotions from other people, as well as some scales that might be distinct, such as, possibly jealousy or something like that.
Mm-hmm.
So based on correlations between our items and other items, we do what's called a factor analysis to identify several factors within the scale, look at which items, if we took the items out, didn't seem to make much of a difference, but if we leave them in, we'll add to what we're trying to measure. So that's I think a very general explanation of what we're doing, but we're going to do factor analyses. Yeah.
So that sounds like a pretty complicated process that takes a while of kind of just messing with the data to see what combination ends up being the most predictive or the most accurate in measuring compersion?
Yeah. I mean, the data collection was probably the hardest part. The analysis, because it's not entirely objective, actually there's a subjective piece to it where we say, do these items make sense together? What is this factor actually measuring? Is it empathy? Is it pride? Is it love? What are they matching up with, for example, the themes that we identified in the qualitative data to begin with?
Right.
Yeah.
So when you found some things, it sounds like you have some kind of preliminary findings, especially from the qualitative part. Could you tell us a little bit about those findings?
Yeah, absolutely. I'm actually going to pull them up because I think it might be useful as I go through each of the themes to quote some of the participants to give you a really good idea of what they're talking about. So we actually came up with about 5 broad themes in the data in terms of what people felt that they experienced when they were experiencing compersion. Probably the most common theme, the most commonly mentioned one was joy or happiness. This is consistent with what we see people writing about in the literature as well. So for example, one participant said, compersion is when you are happy that someone else is happy in a way that has little to nothing to do with you. Another theme included contentment. And these responses often had to do with feelings of calm and security that their partner was being taken care of or being cared for by another person. A third theme was excitement. So when I see them together, I feel happy, giddy, and almost in awe of how cute they are. Yeah. And then for the 4th theme, people were particularly poetic in their language. So the 4th theme is love. And folks used some very descriptive language, such as my heart bursts open, my heart melts, my heart swells, my heart is overflowing with love. And then one person wrote something I really like, which was, compersion feels like warm, fuzzy blankets, hugs, cuddles, smiles, and a day hanging with your best friends. And then the least commonly mentioned theme, which I think was only probably 2 people, was pride or validation. So these were folks who were commenting that, they felt proud that their partner was hot or that their partner was able to score a good hookup. So those were some of the main themes in terms of how people experienced compersion. And like I said, we're now going to look at the data with over 600 participants to see whether these themes hold up.
That is so exciting.
Yeah, it is exciting. The other thing that I'm not sure how interesting this piece is, but I would say the kinds of situations that provoked compersion, we split into about 3 different themes. And this was that people might feel compersion while witnessing their partner's positive emotion. So if a partner came back from a date that they were really, had a really good time on, and they could see how happy their partner was, that would provoke compersion. It could also be provoked by witnessing, like seeing their partner with another partner. Or the third one was witnessing such as like their metamor, so their partner's partner, loving or showing interest in their partner. So based on that person's behavior, they might feel compersion.
How cool is that?
Yeah, so it's kind of fun because I think people use the word compersion in really diverse ways. And so getting a better understanding of like, what do people mean? Like, what are they referring to when they refer to compersion? I think this will help us kind of parse that out and get a better sense of that.
Fantastic.
Yeah.
And I realize that you are a professor who does research. You are not a clinician who has a practice. Even so, do you have a practice too?
I don't currently have a practice. I am licensed to practice in New York and in Pennsylvania.
Nice.
Yeah, and then I moved abroad for a period of time, and since I've come back to the States, I haven't picked up a practice. So that is not ruled out right now. I'm just kind of focusing on my research, but I think within a few years, I'll probably get back to practicing.
Well, even though you're not practicing right now, you still might have some, perhaps a pearl of wisdom to share. If you had one piece of advice for people who want to be effective and knowledgeable and compassionate when serving as a counselor or therapist for CNM clients, what would you say to them? What kind of advice do you have for them, those counselors and therapists?
Yeah, is it okay if I give a few?
Please. Oh, yes, more than one. Go for it.
So I think there's a few things that I've noticed. One is sometimes I see, even just on, Reddit from other consensually non-monogamous people, if someone is struggling with jealousy or struggling in some way in their relationship, I sometimes hear folks saying, maybe consensual non-monogamy is not for you. Which is interesting because I never hear folks saying that when people are struggling in their monogamous relationships, oh, you're having a hard time, maybe monogamy is not for you, or maybe relationships aren't for you. So I think being encouraging of people pursuing the relationship style that best matches with their values, and helping them work through issues that come up as they come up, because we're all works in progress. Relationships are works in progress. One of the things that I learned from a bunch of people responses was that their capacity to experience compersion developed over time. And it was work. It wasn't like, yes, for some folks, it was like, I've always felt this way. But for other folks, it was like, as I've gotten older, I've gotten better at this. And, it's something that people can work on and develop, just like they can work on and develop coping with feelings of jealousy, right? The other thing I would say is that, as I mentioned, there's a lot of pressure to experience compersion for some folks in consensual non-monogamous relationships. And, one person said, I've beat myself up before because I don't experience compersion 100% of the time. So, compersion is, first of all, it's not a black or white concept. Not everyone experiences it, but generally, even people who do experience it to greater or lesser degrees, depending on the situation, depending on where they are with their own mental health, things like that. I tend to think of it as a state as well as a trait. So people have different capacities to experience it, but also, the experience of it varies from situation to situation, depending on other factors. But being really vigilant for folks who are judging themselves or who are feeling shame or judgment by others because they're not experiencing compersion, and helping them cope with that as well. Those are some main ones, I would say.
Great, very valuable advice. Thank you so much.
Sure. Actually, one more thing is that I would say
Wonderful.
one of the things that another kind of good fit that I have thought of personally is acceptance and commitment therapy for those folks who are trained in that. Can be a really great technique, I think, for coping with jealousy as well as developing the ability to experience compersion.
So what is it about acceptance and commitment therapy that helps with that?
Well, so I'll draw on like one person, one participant who said, in response to the question, when do you struggle with compersion? They talk about, well, when I'm not living in the moment and when I'm attached to a particular outcome.
Mm-hmm.
And so I think acceptance and commitment therapy kind of helps with both of those, helps, not judge yourself for experiencing negative emotions and not judging yourself for not experiencing positive emotions, kind of acceptance of where you are, and kind of letting things ride out rather than thinking, I have to feel this way. When you kind of let go of that idea, it opens up actually the possibility to feel a certain way.
Mm.
Yeah.
Great. Wow, that's very useful. Thank you.
Sure.
Appreciate your time.
It's been my pleasure.
Anything else you would like to say about compersion?
I can talk about factors that might be related to compersion if you want, or we can leave that for another time.
Yeah, let's hear it. If you don't mind. If you have
Sure. It won't take very long. I don't have too much to say about it. What I can say is that the themes that I picked up from, I want to talk about the themes of folks who, certain factors that folks found interfered with their ability to experience compersion. Actually, why don't I start with ones that facilitated their experience of compersion? So, a main one was that when people felt like their needs were being met in their relationship, they were much more likely to be able to experience compersion. Another one was knowing and or liking their metamor. So a metamor is a partner's partner. So having some kind of knowledge of who that person is and liking them was an important factor. Not surprisingly, communication about, probably negotiating rules around interacting with other people, but also about getting to hear about people's experience with other people. For some folks, that was a no-go. They did not want to hear about other people's other partners. But for some, they really, their feeling of compersion came from hearing about their experiences. And they felt in some ways privileged or lucky that their partner was willing to share their joy with them about their interactions with other people. Certainly folks felt that when they were in a good place emotionally, so when they were had their depression or anxiety or other psychological issues under control, then they tended to be more likely to experience compersion. When they trusted their partner, and also when they had their own partners. So if their partner had other partners, but they also had other partners, it was easier for them to feel compersion. And particularly when they felt secure in their relationship with their partner as well. Those are, I think, some of the main ones. Some folks did talk about that they felt compersion because they were motivated to feel compersion and they worked on it. And yeah, those are the main ones, I think.
Very interesting research. I sure appreciate you taking the time to share it with us. I think that's fascinating. Especially because it is so little researched. The word has probably only existed for maybe 15, 20 years or so, maybe 5.
Yeah, I think the word probably was the first mention that anyone's heard of it, if I remember correctly, was sometime in the 90s, but I don't think it caught on for quite a while.
Right, yes.
And then there's also the word frubly that was used in England. I don't know if it's still being used, but it's a newer vocabulary word that, no one that I've met outside of the consensually non-monogamous community has even heard of it, actually. And sometimes swingers and people in open relationships haven't heard of it. It seems very specific to the polyamorous community.
Right, yeah.
Yeah. But yeah, so I look forward to developing the scale, being able to be a bit more confident about, what the different components of compersion are, or the different experiences of compersion are, and then developing a research program to help us understand more about what factors increase the experience or the likelihood of experiencing compersion and decrease the experience, which I think has some really important clinical applications. So I'm excited for that.
Absolutely. Oh, I look forward to your findings.
Yeah, thank you.